Now let me speak about what as a patient you should expect in your first appointment with an orthodontist. First, any orthodontist would like to examine you, take a clear or complete case history, like so there are a particular format what we are supposed to know everything. It's called as case history. Once that is done, clinical examination is done, and he might ask you for different investigations, just like a study model. This is an example for a study model. So this helps us in a long way to understand the case. Basically, once we take the model, basically we just pour it into a thing. We get a negative impression, which is done positive by pouring dental stone or material which replicates the old cavity into simple models. Okay, this probably will help us to understand or analyze the whole condition in much better way. Okay, so photographs would be necessary. Then again, some radiographs, something like a lateral cephalogram or a orthopantomogram, or simply called as OPG, would be a clear requirement which would be asked of you in the first appointment. So once you give all these things to us, generally we do our own analysis. There are different analysis what we do, something called a cephalometric analysis or model analysis, which will help us to know, okay, fine, how are we supposed to plan the treatment for this particular case. Okay. Now, for you to communicate with an orthodontist, you should understand one thing, that you have to be very, very clear that what you want from the orthodontist. Obviously, the perception of the problem is very, very different from a patient's point of view and a doctor's point of view. As a doctor, once I see a case, I can understand about 8 to 12 points which patients wouldn't have even have noticed. Okay, so patient would have just come and told us, okay, fine, my just front two teeth are forward, I want to get corrected. So he is concerned only about the front two teeth alone, but he doesn't understand that all the teeth are in relation. Okay, if we have to move the just front two teeth, we have to move the posterior teeth also backwards. Okay, that's how treatment is going to go. And obviously, for them, it's just a visual, conceptual idea what they have. Okay, for us, it's, as I told you, basically when I speak of orthodontics, told you, we have to consider the aesthetic point of view, the functional point of view, and the health point of view also. So based on all these things, we have to come to a diagnosis, and a proper treatment plan has to be devised for that thing. So it's very important that you explain the orthodontist what exactly you require from him. So how better he can help you out in your way. Then once orthodontist receives all these investigations, the models, photographs, radiograph, he would obviously do all his analysis, then present you with a proper diagnosis and a treatment plan. Then you can take a call on that. Okay. So people ask us, when should we visit an orthodontist first? Obviously, orthodontist appointment or his work starts from the day of eruption of permanent teeth, basically, because not many procedures are there for the removal, for the deciduous dentition, but still there are conditions which again we can take in deciduous dentition too. For an example, if we are dealing with a cross bite in deciduous dentition, the cross bite is an interference for closing of the jaw. Okay. In those cases, obviously, the moment we see a cross bite, we tend to correct it, whatever age it might be it 3, 4, 5, or even whatever time we see the patient to, in fact. So there are very few indications for starting an orthodontic or retrofacial procedures at a very young age. So ideally, in ideal situations, the first appointment should start from the eruption of the first permanent teeth, which generally happens at the age of 6 to 7 years. So that's a norm. So once they start, generally once you get a consultation, and periodic observation would be required if something is going wrong. Okay. So otherwise, orthodontist would tell you when to come back. Happens. Most of the patients are concerned basically when they see a teeth which is erupting behind your milk tooth. So people should understand one thing, basically that's how the nature of the eruption of teeth is designed that way. Basically, your upper teeth always comes ahead of your milk tooth, whereas your lower teeth comes behind your deciduous or the milk incisors. Okay. So once they start erupting and the milk tooth exfoliate, So basically you have your tongue which pushes the teeth into its position, and obviously the jaw size at that particular age when the erect is very small. So we should always have this growth concept in our mind.